Okay. Hi, my name's Katya, and I'm currently doing the BA in Global Health and Social Medicine in the Sshm department. I was previously studying Creative Writing and History as a double major at Melbourne University in Australia. And before that, I did IB and graduated from an American high school.
Hi, I'm Hannah. I've just finished the first year of the Global Health and Social Medicine BSc. I'm originally from London and I previously did A-levels in biology, chemistry, maths and politics.
King's as a school was definitely pretty high up on my list of places where I wanted to be, and so I kind of started with that, and I did start quite honestly with the Times top 20 kind of thing, as my parents are into that, so I by default am into that too, and that brought me to King's, and then looking through the programs through UCAS, Global Health and Social Medicine stuck out as something that I'd never read about before, something that was completely new to me. It wasn't traditional, but it still seemed practical. It combined everything that I was interested in. It combined the things that I was good at as well. It seemed like something that I had always wanted to do but didn't know it existed until I read about it on that UCAS page. And I liked how interdisciplinary it was as well. I mean, that was a huge thing for me, and being on the course itself, I found that it really is so interdisciplinary, and it's so flexible as well, and it's just what I wanted it to be, and so whatever brought me to it, it was good, and I'm glad.
Yeah, I was interested in both biology and politics for my A-level subjects, and this course offers the combination of both of them as well as combining other disciplines, and having travelled to Uganda to volunteer at a local school there, I became interested in the HIV and AIDS programme prevention strategies that they were implementing there, as well as the school that we were working in. A lot of the girls were going off and getting malaria and things like that. And I suppose I was just interested to find out more information about what was going on, what was causing this, and sort of the determinants of health per se. It sort of challenges the sort of traditional model of both medicine and social sciences, because it's this crazy combination of them both. So in that way, you sort of look at things that you might traditionally go, oh yeah, for example the Ebola outbreak, that tended to be previously, before starting the course, I would have thought that's just a medical matter and it would be sort of tackled by introducing new drugs and whatever. But now looking at it, I would question so many other different things behind it.
No, absolutely. I think in terms of broadening horizons and giving you new questions to ask as well, and it definitely adds this whole complex layer to things. And with our course, it always seems like you think you found the root of a problem, but there's always another root. There's always something that comes before it, and so
and there's no logical answer either.
Yeah.
There's nothing that you can go, okay, if you do that, or you create that sort of policy thing or intervention.
Suddenly it's fixed. There's no magical policy wand.
And everything is so intertwined and mingled together that you realise you do need to have an interdisciplinary approach to be able to tackle whatever it is.
Obviously, it's a very desirable degree to have. If you're coming out of something, it's a completely brand new course, first in the UK. You're coming out with a BSc, supposedly BA, but you could come out with a BSc with this amazing, first of its kind cross section between the social sciences and medicine, essentially, and that's important, and that's not seen before, and it's something that's so emphasised. I mean, on the course it's emphasised that there's this lack of communication, there's this lack of connection between these two fields, which are logically just so linked, inevitably linked, and importantly linked as well, and all the research and the things that happen, they need to be linked, they need to communicate with each other. And I think at King's we were meant to be that connection.
Bridge.
Yeah.
Basically. But I feel like the course lets you do anything you want to do.
Yeah, absolutely. So
whatever your interest is, you can do it.
One of my favourite aspects of the course is just how flexible it is. Essentially, every assignment we've had, every class we've had, there has been wiggle room for us to go, okay, this is a topic that interests me. This is the way that I will develop this question and just mould it to the class, and you create content that is relevant, but is still what you want to do and still what you're interested in. So for me, I've focused a lot on mental health in a lot of my writing, and I've had the space to do that, and which is amazing because a lot of degrees aren't that flexible at all, and they're really rigid. Whereas this gives you, you get to explore your own research paths, and because research is such a huge part of this degree, you know, it's so important for later life when you actually want to become a researcher or you want to go to a higher level. You know, you have to know what you like, you have to know what you're interested in. And so I think it's so good that we develop that so early on in the course as well.
Yeah. And you literally get the opportunity to do anything you want to do. I mean, I wrote an essay on cartoon portrayals of the Ebola outbreak in American media, and it was just looking at things like risk perception through cartoons, essentially. And so that just sort of reinforced how random, I suppose, and yet related it is to global health that you can do.
And at the same time, for like the same assignment, I was probably talking about like the portrayal of anorexia through like quote pro-ana communities and forums online, and comparing that to the feminist movement and the body positive movement, and if there were parallels, if they were dissimilar. So, you know, and that's like the same essay for the same class, but completely different takes on a question or a theme that we were given.
And that's just, I think that's one of the great things about our course, is that within it you've got everybody doing such different things and different research areas. So you're able to sort of walk around and go, wow, so tell me a bit about what you're doing, and you just find out so much more information from just talking to each other as well. Like A-levels, it would be just like learn the textbook essentially for the exam and that's it. Whereas all of a sudden at university it was choose what you want to do, research it, find out about it, and go to like talks, find out more, talk to different people about it. And I think that's just, it's really nice, and it gives you that sort of freedom.
Once you love something, you're interested in something, then you care about it. And I think like that's such a good way to learn, is that if you love something and you're passionate about it, you actually care, you actually want to learn more, you want to read more, you want to even write more. What I love most about our department is, this is very cheesy, it's the people who work in our department. I think we are so lucky to have the body of staff and the professors that we have. This is, I mean, I've been to university before, and my experience at King's within this department is completely different from what I had before. Here they genuinely, like, they care about you, your professors care about you, your tutor cares about you. They want to help you, they want you to be able to get a job, they want you to do well in your assignments, they're not there to set you up for failure. And I think that's so important, like to just be in that environment that is supportive and is really stimulating.
I think the diversity within the department, you've got academics from loads of different disciplines like sociology, anthropology, like bioethics, medicine, and I suppose all of that coming together for like your teaching, it actually gives you a fully interdisciplinary understanding of a range of different topics, which is great.
Like King's has so many talks. Like for example, we were at a Paul Farmer talk, which is amazing to see this man in the flesh.
It was amazing, like particularly when applying, you're sort of going through and finding out about global health, and he was one of the things people I was like, wow, that's amazing, I'd love to be getting involved. And then when they were like, oh, there's a talk by him, we were starstruck.
It was definitely the right word. Starstruck is definitely the right word.
There's like loads happening academically and socially, that you're never bored. You always find that there's something going on, whether it's in the department or at King's in general. Or...
If you're bored, it's like your own fault. Like, you don't have an excuse to be bored. There is always something you could be doing. Probably you should be doing as well. But like, you should.
And there's loads of opportunities, like loads of random stuff I do.
You do loads.
I do like sailing and like physical theatre within the department.
When did you do sailing?
I don't know. I did it in Canary Wharf. Yeah, I know, even more random. There's loads of opportunities, and if there isn't a society, you can always set one up, and that's what we've actually done. We've set up our own Global Health Society, specific for our course and the department, as well as trying to encourage and sort of disperse about global health throughout King's.
Oh, it's fantastic actually that we can like just be like, well, this doesn't exist, so we're going to create it. And why not? And to get like, you know, not just funding and support from KCLSU, who have been fantastic, but also the department has been so positive and has been absolutely wonderful in like helping us set everything up, get contacts, get funding, and we've had meetings with them already just to talk everything through, and it's been really lovely. And they're just like here's my contact sheet, and it's just like incredible people.
Yeah, like a list of amazing people. So the location of King's is just excellent. Like being in the heart of London, there's so many opportunities and things to do that it's just great.
Yeah, no, absolutely. And of course I was lucky because I got into student hall, so I was living at Moonraker Point, which is prime location, and King's is wonderful because they subsidise it. And I get to walk to uni like every day, and I would get to walk across Waterloo Bridge, whenever I wanted, and that is a view that I could never get tired of. Like, you're literally in a postcard right now. You're walking across this bridge. You have just every landmark possible on either side of you. It is such a wonderful bridge to walk across. I could never get tired of that.
I don't think you can get tired of London. Yeah, I kind of have an idea of what I would like to go into. So at the moment, the research area that I'm considering is looking at like re-emerging and emerging infectious diseases, particularly in conflict zones. So for example, like in Syria, with the civil war, how healthcare systems have been used as both a weapon, as well as seeing how the use of targeting healthcare has actually led to the re-emergence of so many infectious diseases. So for example, like the polio outbreak. So I'd like to get involved in that sort of area of research, and possibly doing that through a graduate medicine course is one opportunity that I would be considering.
I see myself probably ending up with an NGO, probably ending up perhaps with a government agency, but probably in some kind of public health policy setting, I think.
And I think it's nice because even like, for example, for me, I kind of know I want to go down infectious diseases. Talking to like people like Katya about like mental health and maternal health care, you sort of see how it all links together as well.
Absolutely.
And how they all intertwine.
Yeah.
So it's useful to be learning about them as well.
And it's funny as well because, you know, meeting these other people, you know, I can say that there are so many things in front of us, but I do have the knowledge that there are people who care about them, even if it's not my path and that's the route I want to go down. Even if I care about infectious diseases, but I'm thinking, you know, that's not my research interest, you know, I still know that it's a research interest that's in good hands.